screen. And we could see the RFP. Looks like it. No, that's not the right one. My bad. Hold on a second. That's a different letter about the RFP. Okay. Try that again. Okay. All right. So on Friday, October 18th, the announcement went out to the entire community, including, Children's System of Care, our local Children's Interagency Coordinating Council, or Kayak, Najama, Candid. So it's, we hope to get this announcement out to as many people as possible so we get a good selection of proposals. It's a pretty general, it's a pretty broad, I guess, RFP as far as what can be created, what can be done. But just to go over this, every year, Children's System of Care under Department of Children and Families provides these. Most years, there was only a couple that they haven't in the 17 years I've been doing this, but they offer this certain funds every year. It's been about the same, around 70,000, 67,697 and they give us the liberty to do this how we want. And in Ocean, we decide to keep it broad, so we hopefully get more ideas, more proposals, just more creativity instead of limiting it. But it is really just to develop and/or increase the availability of community-based resources to Ocean County youth experiencing emotional, behavioral, developmental, intellectual, and substance use needs and their families. So like I said, it's the total amount available is $67,697 to fund one or more projects. We do want these projects, whatever the services that might be, that they are available in person. We don't want any more virtual services. It really just doesn't benefit the youth and families that we serve all that great. And these services are not just for the youth and families that Ocean Partnership for Children serve or Ocean County's care management organization, but it has to be able to serve the kids. And our kids have some very high needs. The acuity is nothing like I've ever seen before by way of trauma, suicidal ideation, a lot of kids with intellectual developmental disabilities. So we did kind of choose a few specific needs that we would really like to see addressed because there are service gaps in these areas. And like I said, that would be IDD or the intellectual developmental disabilities or neurodiverse youth, so social and therapeutic groups, mentoring and or respite programs, behavioral health services for young children, 3 to 10. It could be up to 10, really 0 to 10. We don't have many for them. Something along the lines of like play therapy, sand tray, psychoeducation, socialization, parent-child interactive therapies would be ideal. Acute mental health, like I mentioned before, suicidal ideation, first episode psychosis, trauma, reactive attachment. We see a lot of that. And there's not too many therapists that specialize in those areas. And just to be mindful, over 95% of the almost 1,100 kids we are serving now have straight Medicaid. So they are lower to moderate income. So that needs to be considered, that you're able to serve the lower income youth and families. So transportation, food, incentives are always helpful to get them to go to the programs. Social determinants of health is another area we'd like to see. Housing, we know housing is a real challenge right now. Early education, childcare, food, minority status, especially Spanish speaking. About 10% of the youth and families we serve are Spanish speaking or Latino. Orthodox Jewish is also a big population in our community that can always benefit from more services, and LGBTQ population as well. And it's not like, preferably you're not serving just one population, but that there's equal access to all the populations. I know you can't serve everyone though, so but just keeping that in mind, it can't be exclusive. Integrated health programs are always good, whether it's substance use and mental health, or physical health, mental health, anything integrated. Specialized childcare for youth with behavioral health needs. There are really, if you have a young kid in need of childcare or aftercare that has special needs or challenging behaviors, they not really last long in any of the childcares that exist right now. They just don't have the means to cope. So anything that could work with the kids with special needs or behavioral challenges in childcare, either daycare, aftercare, would be amazing. I did say Spanish speaking services in our groups, ACEs, adverse childhood experiences, that stands for. If you're not familiar, if you look it up, it's everywhere on the internet. Services to address youth suffering from eating disorders. In person, we do have virtual options, but nothing really in person for the eating disorders. Parenting needs, especially evidence-based behavior parent training, like I mentioned earlier, something like parent and child interactive therapies would be great. And then services for the youth 18 and older, those transitioning out of youth or children services to adult. There's that gap from 18, I would safely say, to we serve up to 21, but 24 regarding housing, independent living skills, vocational, educational needs. That's a big area. So although I said we narrowed it down, it's not all that narrow. If you see, that's, 2, 4, 6, 8, like 12 different areas. So, so there are, in the RFP, the last few pages, there are different needs assessments and data sources that were cited to that, support the needs of these in these areas. And when you are completing a proposal, you should be citing where, especially if you're saying evidence-based, best practice, that you're citing stuff. It doesn't necessarily have to be from the data sources and needs assessments we have listed, but if you just be mindful of that. This is really to just help out the providers with where we're getting our information. Aside from just doing this day in and day out, you kind of know, but we want something to support the claims or the programs that you're suggesting. Collaborative. Okay, so like I said, the funding solicitation reflects current needs of youth served by Ocean County's Children's System of Care and the general New Jersey Children's System of Care, so for the whole state. And these are guidelines put out by Children's System of Care. So there is protocol that we're following from the state regarding this RFP. Collaborative applications that maximize the impacts of the funds are encouraged. 70 grand is, as we know, it's not really all that much money. So if you can get creative with collaboration somehow, that's always ideal. And all of the awards, at the end of the day, we go through this, we get the proposals. There's a proposal review process. Once proposals are selected, they are requested, those agencies, to present to our proposal review group, who ultimately recommends which proposals to be funded to Children's System of Care. At the end of the day, the Children's System of Care makes the ultimate determination. It's really out of our hands once we're done with this proposal. We do advocate. They will ask questions. We would be in touch with any proposals that are recommended, and we do try to do the best that we can to get people funded and really advocate for the proposals that we've recommended. So like I said, bidders meetings today. The RFPs are due December, which is, I know it's not the best time of year, but the state provides these timelines, which we've again advocated for some expansion on, or maybe not through the holidays, but the state works on the fiscal year July to June, so it makes sense for their funding for their contracts for it to be now, so that they can get their everything together by July, hopefully, which I'll tell you that doesn't always happen. So there is flexibility with these dates. They may be changed. They may not follow this exact timeline, so keep that in mind. Like I said, on January 8th, which is a Wednesday at 2 p.m., we'll do the RFP presentations or the proposal presentations. We do them virtually with a proposal review team that's made up of some of OPC's staff, board, and our community partners, usually Kayak, Mobile Response, if they're not submitting anything, if Preferred's not submitting anything, and Youth Services Commission. So the selection is due to Children's System of Care February 28th. And then they will let us know by May 16th if they're approving the funding. So that gives them almost 3 months to go through all of the proposals that are, I think all of the CMOs are going through this process. So that's 15. So it could be at least 15 proposals they're reviewing with a fine tooth comb. And I'm not really kidding about that. And then the project implementation should be July 1st. But like I said, we are flexible with that, given when the funding comes in, when the approvals come in, just however the program's going to run. So we work with the agencies to, just make it work the best that it can. What was I going to say about that? It'll come back to me. I can't remember what I was going to say about that. So we're doing the bidders meeting, the Q&A now. This is just a rundown of just a little bit more in depth about the proposal submission deadline that should come. The proposal should be completed in Word or PDF and sent to me via email in an attachment. I would prefer a phone call or and a voicemail just saying it was submitted via email, because sometimes there's been that they thought they submitted it and I didn't receive it. So just to make sure, if the proposals aren't in by the deadline, we can't accept them. If the proposals are incomplete, we can't consider them for funding either. Okay. Oh, that's what I was going to say about the project implementation. This money should last, the program should last at least a year with this funding. But again, and so the deadlines start later or they start early. It just depends, but just keep that in mind. It should last a year and ideally have a way to sustain beyond the funding that we provide. Which is not easy. We understand that, and there is an aspect of the proposal that should speak to the sustainability and the plan to sustain it. Talked about the proposal review and those dates. All right, so now, so the application, please make sure this page 5 here, that is it 5 in the 7 actually. The thing that this part is completed with at least the top, and you can hand that in just with the name of the organization, the contact, all that. And then the proposal should be answering these 6 areas, and make sure the bullets that are under those 6 areas are being answered. I prefer short, sweet, to the point. It doesn't have to be a long, elaborate proposal. There's no page amount. I hope it's not 100 pages because I review them all. And I mean, it really shouldn't need to be. It should be a simple proposal about a program. Just the needs statement, what you're suggesting is, that you're understanding the needs of Ocean County and what the program you're proposing meets some of those needs or gaps in areas of service. Cultural competency is important. We do have, I know Ocean County is not extremely diverse, but there are very diverse areas of the county. So trying to serve those populations is ideal because they are completely underserved, Spanish speaking, especially. Like I said earlier, please cite data sources in the RFP. I'm sorry, in the proposal. Then section 2 would be description of the agency and history of services to youth and families. So really you want to tap onto the history of the agency, the organization's capability to initiate and sustain the proposed program. Although it says preferably evidence-based, promise practice expensive program, so it's not a requirement, but if possible, there's out there supporting a program, and how it would benefit, youth in the with the behavioral health needs that we were speaking of, and intellectual developmental needs, substance use. The description of services. So this is the plan, the actual program that you're proposing, the implementation plan, what that's going to look like, the actual activities and services to be provided, background, qualifications, and justifications of organization, as well as staff to provide those services if that's the service requires that. An agreement to serve Medicaid eligible youth and families. Not that the program has to bill Medicaid. The state will not fund a program for startup costs that then will be billing Medicaid. They're pretty adamant about that, even though I always liked the fact in the past that we could use it for startup costs and then have a sustainable plan, because otherwise there's not really, sustainability is tough if we're banking on fundraising, but people get creative. The agreement to serve all eligible New Jersey Children's System of Care youth, so CMO, mobile response, even though, yes, they can be the most challenging, they need to be the ones that are being served. And like I said, it doesn't just have to be those kids, it can be anyone from the community as well. And then how long the service, the period or term of service will last for, which should be about a year, given the funding. So anticipated outcomes. What is the sustainability plan? How is this going to be sustainable after the initial funding? Is it fundraising? Is it, becoming, you have to get creative in that area. Maybe it's partnerships with community, other community organizations. There's different possibilities there. We also want to know what are the anticipated quantifiable deliverables, levels of service and or outcomes. So how many kids are you going to serve? How many kids do you plan to serve in that time period? How often, if you're running a group, is it weekly? So make sure you get specific, or you have those smart, specific, measurable, attainable, realistic, and time framed outcomes. And then that you're affirming, you're required, there's periodic fiscal and or program reports. Currently, it is a kickoff event report with a narrative and then it's two more reports, 6 months, and then the 12 months. How many kids were served, narratives about how the program, like outcomes, successes, challenges, barriers. So that will be a requirement of the program, the proposal. The state has changed it a couple times in the past few years, but it's been somewhat consistent. So I'm pretty confident it will stay that way. They don't ask for budget updates, but we just simple that, how much you're spending. It doesn't have to be elaborate line items and all that. It's pretty straightforward. Like I said, simple, keep it simple, please. Evaluation methods. So I kind of touched on that with the anticipated. Are you evaluating the effectiveness of the program? A lot of times it's surveys before and after, but it just depends. Sometimes people do it depends on the program, how you're evaluating it ongoing. And those reports that you would be doing is gonna, we'd want to see like exactly that. What are the evaluation methods that were used? And documentation of quality assurance efforts and outcomes monitoring plan. So it's all, just making sure that things are, just evaluating how well things are going or not, and if things need to change. We have had times where the programs aren't doing too great, so we've had to kind of have some alternative planning or modifying the program a bit to maybe make it more accessible. It just depends. There's so many different ideas that come up. It's kind of hard to say what it could be. The budget is the last one. Exact amount of funds requested and detailed budget for the expenditure of these funds. So it should be the budget for the 70,000, not your or the 67,000, not your organization budget. So it's specific only to that program and whatever costs, staffing, supplies, admin. Admin shouldn't be that high. The state won't give a number. I think 10 to 20% is generally acceptable, but the funding really should be going towards the programming for the kids. just make sure to include with this application here, list of board members, set of recent financial statements. If you have funding from other sources, such as Department of Children and Families, the county, anywhere, please make sure to list them. They want to avoid duplicating funding to the same programs through, any state dollars, especially. If you're applying for CRD funds in another county, please make mention of that. I'm not really sure where they're landing with that, but I don't think they want to fund the same program in multiple counties, though we've had some really good proposals about that. So if that comes up as a possibility, we can discuss, and I would have to go back to DCF or CSOC about that, trying to advocate for like the best practice outcomes with them. Is not always, they don't always see things the way maybe we do, but we do our best to work, to advocate. And if you have ever been funded by Ocean, our community resource development funds in the past, please make sure to indicate yes or no to all of those things, or just list what's requested. Like I said, if further information is needed from the proposal, a budget modification, if we like the proposal, but there needs to be some modifications, we will be in touch to discuss that. It could be at the end when CSOC comes back, they say, we want to see X, Y, and Z done. And we kind of have to pivot and go back to the providers if more than one program. So just like I said, it's flexible, it moves. But we try to stick to, this RFP and the timelines and guidelines best we can. And last, like I said earlier, at the end of the day, it's CSOC's final decision who gets funded or not. So this is the rating sheet that the proposal review team uses. So just once you write your proposal, you can see where the sections, how they're weighted, how much points they get, and make sure that you are answering these questions in your proposal. That's what we go by to guide when we do the proposal ratings. We do rate them and then comment. And then that's how basically who the highest rated proposals, say we get 12, which we only really have time to have about 4, maybe 5 presentations. So we pick about the top 4, I would say, based on the ratings. So it's important that you're paying attention to these and hitting on the points under each section. And then last but not least is the needs assessments and data sources. These are links in the PDF. So you can click right on them to get to those areas. And then below is just some of, the identified areas, and the one relates back to this first section. That's where that information was found in those assessments and evaluations. So that's all for the RFP. I think I hit on most things, but do we have any questions?
Yes.
Sure, Allison.
Katie,
Hey.
For the financials, the how recent, and can they be unaudited, or what do you prefer?
They can be unaudited, and on it says 6 months, but 3 months is fine. Just something to prove that you do have the funding, that you can, that you're a legitimate agency.
Okay.
And we've come across where there's a brand new agency starting up and going for funding, so they didn't quite have it. And like I said, we can work with the agency that might be definitely something we consider, the experience of the agency, their capability, obviously, to run a program. So that helps, but it's not always 100% required. It really just depends.
Okay. And for the needs statement, we can cite a few of what you've provided. We don't need to use every single one.
Nope. Okay. And you can, whatever makes sense, and you might have your own, sources that you can use. So as long as they're legitimate.
Yep.
Yeah.
Hi.
Hi, how are you? So, my question, I know it does seem kind of geared towards emotional behavioral support, which I know is a lot of what you do. I think you know Madison, we serve kids with significant physical developmental needs such as cerebral palsy. Do you think it's a fit? Or because I do notice you say developmental, or is it
Yeah,
really geared towards
intellectual.
the behavior? Yeah,
We
and
work
they do have intellectual.
I'd say right now about 400 of the 1,100 kids have an intellectual or developmental disability need, neurodiverse. So yeah, that's fine.
Okay.
Um, there's a high need in that area because there's not many services out there. There's not much community based. So,
Hmm.
and it would really need to serve the community, not just the kids in your program.
Right, okay. So that's the big difference. It would need
Mhm.
to be something that was open outside of our scope of like the kids in our school, let's say,
It could be that population, but accessible to kids outside the
to
school as
others.
well as your
Okay.
kids. Yep.
Okay, great.
Hmm.
Thanks.
Any other questions? All right. Usually this is how long it takes, about a half hour. So, and along the way, if you have any questions, you can always reach out to me. I'm willing to, I can answer a lot of the questions. I can't tell you exactly what to do or if it's going to work or not, but people run ideas by me and I'll say, yeah, that could work or that might not work, just kind of like Louisa just did. So, um, feel free to reach out at any time. And thank you all for coming. Appreciate it. All
Thank
right.
you.
All right. Have a great day.